Technology has developed a new non-surgical spinal treatment system called Antalgic Track. Only the new Antalgic Track system provides doctors with advanced treatment tools that eliminates pain without surgery. Experience the most technologically advanced non-surgical spinal decompression system. For your free, no-obligation consultation and information describing Antalgic Track's innovative treatment, call the number on the screen now. This program will reveal everything you need to know to make the important and profitable decision to have the Antalgic Track delivered to your office. Antalgic Track is revolutionary, custom-built, affordable, and ready to be shipped for immediate use. If at any time you wish to speak to someone personally, simply call the local number provided. Our dedicated experts will gladly answer any questions you may have. Call today to order an Antalgic Track.
Hi, I'm Raquel Landry. I invite you to stay tuned because a revolutionary spinal decompression therapy system has emerged into the market, and it's creating quite a buzz among medical professionals and doctors just like you. We're going to talk to the doctors and experts behind the new Antalgic Track and the specialized treatment performed by it called Kinetic Decompression Mobilization, or KDM. We'll break down the many treatment options that the Antalgic Track offers and how having just one Antalgic Track in your office could generate more than $500,000 in a single calendar year. So if you're ready to take your practice to the evolution of therapy, join me.
Technology has developed a new non-surgical spinal treatment system called Antalgic Track. Only the new Antalgic Track system provides doctors with advanced treatment tools that eliminates pain without surgery. Experience the most technologically advanced non-surgical spinal decompression system. For your free, no-obligation consultation and information describing Antalgic Track's innovative treatment, call the number on the screen now.
Hello again. The Antalgic Track is the newest and most modern way of performing cervical or lumbar decompression. No other piece of equipment performs quite like it, and over its development, Antalgic Track has evolved into the most dramatic and innovative decompression system ever manufactured. Joining me today is Dr. Scott Denny, past president and current board member of the American Academy of Pain Management and vice president of Spintronics, the makers of Antalgic Track.
For many patients who suffer from herniated, bulging, desiccated, and compressed discs, all have reduced annular elasticity. As you can see, this creates intersegmental fixations that are caused by pre-existing fluid dehydration processes. What's the treatment solution? Antalgic Track's Kinetic Decompression Mobilization Protocol, or KDM, is based on a systematic series of postural mechanical movements performed under the pulling forces of decompression, which allows us to focus and target these areas.
Well, let's talk a little bit about KDM. This is something that is exclusive to the Antalgic Track. Is this correct?
Most other systems just offer straight linear decompression, and so does the Antalgic Track. But Antalgic Track includes an exclusive ability to articulate and position posture portions of the machine. It does this using cervical and lumbar 10-way articulating sections. These movable positional sections allow the doctor the ability to focus and target the forces of decompression based on each patient's needs, improving the clinical outcome.
None of the systems available can perform all of the methods that only one Antalgic Track offers. This system delivers a complete and precise approach to decompression therapy. Antalgic Track is so effective and impressive that your patients will have complete confidence that they've chosen the right doctor.
Patients accepted into the KDM program realize that the goal is to ultimately normalize the dynamic mechanical functions of their spine. And improved function means improved patient outcome.
A recent treatment using decompression and including 219 patients showed that 86% of them recovered from their symptoms. In fact, when these patients were rechecked 90 days later, 92% of them remained symptom-free. These are impressive results.
As we already know, Antalgic Track is unlike any other therapeutic table on the market today. But only Antalgic Track offers the industry's first therapy that can restore the spine's range of motion and can establish hydration of the discs with improved intersegmental motion. These are key factors for spinal health. Improved decompression targeting means improved decompression results, and there's no better way to stimulate your practice growth and generate hundreds of new referrals than by providing results to your patients.
If you're still not convinced that the Antalgic Track is the perfect new piece of equipment for your office, stay tuned, because when we return, we're going to have Dr. David Bass, President and CEO of Spinetronic, show us a hands-on demonstration of how the Antalgic Track outperforms every other decompression system available today.
Well, I like the Antalgic Track because it makes me proud as a mechanical engineer because of all the easily serviceable features. When a patient is sitting on this machine, he should realize that it's a very highly technologically advanced product, very ergonomically well designed, and I think it'll be a pleasant experience for anybody.
Antalgic Track's spinal decompression machine is specifically orientated for a range of motion.
I designed the multi-axis joint for the Antalgic Track to be more anatomically correct. It has 3 distinct axes that move independently from each other. This enables you to more accurately target the area of treatment.
Antalgic Track incorporates the most range of motion of any device on the market. Therefore, there were large frictional and kinetic forces that had to be taken into account during the design.
When I first started studying spinal decompression equipment and the products that were out there, one thing was very obvious to me is that there's a lot of crude concepts out there that have been existing for a lot of time, and there's a lot of room for improvement, quite honestly.
The design concepts that have gone into it are revolutionary. You will not find them anywhere else in the world.
It's very robust, it's very reliable. We use superior materials, superior parts. Everything is the highest grade.
Technology has developed a new non-surgical spinal treatment system called Antalgic Track. Only the new Antalgic Track system provides doctors with advanced treatment tools that eliminates pain without surgery. Experience the most technologically advanced non-surgical spinal decompression system. For your free, no-obligation consultation and information describing Antalgic Track's innovative treatment, call the number on the screen now.
Welcome back. Dr. David Bass invented the Antalgic Track with the sole purpose of improving control over the patient's treatment outcome. Specializing in pain management since 1980 and having one of the largest solo practitioner clinics in the Northeast United States, Dr. Bass was convinced that there was a need for a functional evolutionary leap in decompression therapy. He's here with us today to demonstrate how the amazing Antalgic Track works.
I've always enjoyed practicing with state-of-the-art equipment and believe that the quality of equipment enhances clinical growth and enables doctors to reach their true treatment potential. We've designed Antalgic Track to get faster and more improved results beyond any other system available. We've been able to develop and engineer this system to offer superb decompression combined with range of motion posturing.
The Antalgic Track has the ability to position a patient into multiple postures, more than any other device on the market today.
Antalgic Track reduces disc pressure, bulges, herniations, nerve root pressures, pinched nerves. It improves spinal joint mechanics and function, facet gliding, and reduces facet imbrication. And as Dr. Denny stated, these movements increase spinal joint elasticity. From the moment you get an Antalgic Track in your office, you'll soon see how convenient and user-friendly this machine truly is. The Antalgic Track has multiple features, from form-fitting body cushions and computerized touchscreen display to taking up less space in your office than any other decompression unit.
Okay, well, we have Victoria ready, so what do we do from here?
Well, I'm going to demonstrate with Victoria a cervical decompression. She's on the unit and in position, so all I'll do is raise our headpiece to elongate the spine, and when I have the desired weight, I'll teach that to the machine, then I'll relax it and teach that, go to my therapy screen, set a time session, and go. Once therapy begins, I'm able to position the cervical spine to any variety of positions to accommodate her specific condition. This achieves our results faster.
Clinical research has acknowledged that the angle of pull is important for targeting the desired disc.
Antalgic Track allows lumbar, pelvic, or cervical mobilization positioning during sustained decompression. So I'm able to loosen a clamp, and I can rotate the spine as far as the spine needs to move. And in addition to rotation, we can side tilt, and we can even flex forward and backward. And these angles are nearly unlimited. Antalgic Trac's exclusive KDM protocol helps take the guesswork out by reestablishing the spine's range of motion. Antalgic Trac's onboard computer offers you the opportunity to customize treatment programs. You'll be effective and versatile in treating spinal compression problems.
Imagine patients being happy to come into your office for treatment and being grateful to pay. That's what results do.
We're the only range of motion decompression system in the world. You'll soon agree that no other piece of equipment can do what Antalgic Trac does. Antalgic Trac will give you the treatment edge in today's competitive patient market.
If you don't have the Antalgic Trac in your office, you're just not giving your patients the best decompression mobilization therapy available.
I saw the tables. They were, they were offered in chiropractic magazines and other types of, medical journals. I just decided, let's go ahead and try this thing. I'm very curious, and this is a lot like the vision I had for treating disc injuries.
We can, flex, extend. You can flex it laterally, extend it laterally. You can rotate a lot of things, open up or try to straighten their vertebrae out or spine out a little bit, as well as decompress from the disc, bulging disc, herniated disc.
The main screen where you program everything is completely adjustable, moves in every direction you can imagine. And you can put it on the right side of the decompression table. You can put it on the left side.
But our patient load is full. We're full every day. We're still trying to find ways to squeeze people in just so they can get their 2 or 3 treatments a week.
What I appreciate about the Antalgic Trac is not only is it easy to perform by the physician or your therapist, but it has 2 different types of safety features that allow the patient to be in control of their treatment.
The lumbar part of this machine and the cervical part of the machine are basically, it's all one machine.
It's quite simple. I'm Dr. Ray Saidpour. Here at Dunn Clinic, we utilize the Antalgic Trac decompression table.
We hope you appreciate the technology and engineering that ultimately became the Antalgic Trac. Our exclusive protocol and Antalgic Care non-surgical care are important tools for this new evolution of therapy.
We understand that buying new equipment for your office is an important decision, and we want you to feel completely comfortable when your new Antalgic Trac unit arrives at your office.
To make your purchase as effortless as possible, we offer one-on-one customer service and support, plus access to Dr. Denny and myself via email or phone.
Plus, leasing options from leading medical equipment lenders to make your Antalgic Trac purchase easy and convenient.
Every Antalgic Trac comes back with an extended warranty. That means we'll fix it or replace it absolutely free.
So we invite you to pick up the phone and order an Antalgic Trac today. No other piece of equipment performs like it.
Now that you know about the revolutionary Antalgic Trac and its many features, owning one is affordable and easy with lease programs available from top medical equipment lenders. You can get an Antalgic Trac delivered right to your office.
Our exclusive KDM concept and Antalgic Care treatment protocol allows you the opportunity to increase or establish your patient database by diversifying treatment options.
The Antalgic Care protocol includes treatment sessions ranging from 20 minutes to 60 minutes and span 3 to 8 weeks, allowing you the opportunity of 15 to 24 sessions per patient. Typical treatment costs range from $175 to $245. A series of closely scheduled sessions works best. Although all results can't be guaranteed, it is logical and recommended to follow the established protocol.
The Antalgic Trac has the ability to generate upwards of $500,000 of revenue or more per single unit, assuming you have 3 new patients per week and an average of 10 treatments per day during the course of an average work week.
Current insurance limitations create treatment issues for patients. It is increasingly important to offer finance options to patients needing care that don't include doctor discounting.
Antalgic Care is not continuous ongoing care. Its objective is to deliver effective lasting results in the shortest period of time. Patient finance options are available if you contact our office.
You can have the Antalgic Track delivered to your office, have all of the benefits, treat more injuries and problems, treat more patients, and have greater profitability.
If at any time you wish to speak to someone personally, simply call the local number provided, and our dedicated experts will gladly answer any questions you may have. Call today to order an Antalgic Track.
My medical condition is I have 2 herniated discs in my lower back.
I have 2 herniated discs, one the L4-5 disc and the other the L5-S1 disc.
I have scoliosis and also was recently in a car accident.
Well, the last 2 years I had cancer of the bladder and I took chemo, and chemo softened up my backbone. And
the accident that caused my injury to my lower back affected my whole life, personally and professionally, and my ability to walk and do everyday normal tasks.
It happened as a result of a lot of contact sports that I played throughout childhood and high school in particular.
I could no longer bend over to open the dishwasher. I could no longer carry laundry down the stairs. I could no longer play baseball with my kids in the backyard.
My case is not severe, but of course I've had some pain associated with it for years and it was undetected.
Running is very painful for me. A lot of the stretches involved just in any sport is difficult for me. Even just like waking up, like getting out of bed in the morning, standing up from sitting down, any change of position can generally throw up some pain. So it really has a big impact on the way I live my life.
Dr. Ray recommended no medical drugs.
the decompression is the only thing that's probably would have helped me.
It just makes it a little bit easier to get out of bed. There's a little bit less pain each day. It's a little bit easier to run if I want to, play a game, pick up football with friends.
I lead a very active lifestyle. I teach, sing, and model, and so obviously I need to be as pain-free as possible.
Today, 10 months later, I don't have a pain in my body.
Between treatments, my neck is better extended and I have a lot less pain.
At this point, I've used the machine 20 times and have had a decrease of about 80% of the back pain that I have.
this point of the demonstration, I'm going to set the table up for cervical decompression elongation. It is currently set up for lumbar elongation. So to make the change from lumbar to cervical, I would first lower the axillary supports, remove the pad that we use for lower back decompression, and exchange that with the custom fit unit for cervical decompression. Then I remove the scapular pads, retract the thoracic latch clamps,